Would you mind saying your name, your title, and your degree?
Sure. My name is Edwin Wallace. I'm the academic advisor in the College of Nursing and Health Professions at Arkansas State University. I worked in the radiation therapy field for 5 years prior to this. I have my bachelor's degree in radiation therapy. I have another bachelor's degree in radiation sciences and an associate's degree in radiation sciences.
What would you say some of the pros and cons would be of working in the medical field and the specific department that you worked in?
It was absolutely wonderful field to work in. Every day that I went to work, I felt like I was doing work that was appreciated by the patients and myself. Great environment to work in, wonderful patients to work with. They always were so thankful for everything I did. But at the same time, it was a little sad on occasion. You might get attached to an individual that wasn't doing well and they may not make it. So every once in a while I'd lose one and it could be depressing. Another con would be working in healthcare these days is very business oriented. So organizations put a lot of pressure on their individuals who work for them and may not give them the merit that they deserve. And that was generally the case with me.
Right. So if you go back to your college years, what is one thing that you are really glad that you did in college, and then what is something that you regret the most about your college years?
One thing that I'm glad that I did was actually applied to the program here at Arkansas State. Once I got into my program, I was happy throughout X-ray and then radiation therapy after that. It was a great program. I really enjoyed those 3 years. And the bonds that I developed with all my classmates, whether it was just in X-ray, I have 45 other classmates, and then my 6 other classmates in radiation therapy. My biggest regret was coming to A-State and not knowing what I wanted to do at first, and losing all of my scholarships and everything because it was a new environment, I wasn't used to it, and I lost everything. So it took me 2 years to recover from those 3 semesters that I did poorly in so that I could get into our program since it is competitive to get into.
Do you have any advice for anybody who was going through the same thing as you were, not knowing what they wanted to do or how to go about finding a major?
Right. Yes, I do have advice. I think it's common to get out of high school and not know exactly where you want to go. So I think a lot of students are apprehensive to change their majors once they start at A-State. They think that the major they start in is what they have to finish in. And I don't think that's the case. I think there needs to be more positive reinforcement, more events like the Pick a Major Fair, where you can talk to the various majors, get your feet wet in some of those fields, take some general interest classes that you might be interested in, and that may be the majors that you need to pick. So I think some of that reinforcement is lacking in higher education overall. My advice to students would be to immerse yourself in whatever you're interested in. I wished, going back to my first time in 1999 at A-State, I would have gotten some immersion into the healthcare field. I came in blind as a business major, and so I wished I would have taken the time to go to a hospital, visit with them, learn more about the various departments, because I think those experiences, shadowing or that sort of thing, is very important.
When you worked in a hospital, what was your schedule like?
My schedule, I worked a little bit in X-ray while I was still in school before I graduated from radiation therapy school, and that generally was overnights, specifically on weekends or holidays. So I would work 12-hour shifts mostly by myself in Osceola, Arkansas, locked in the department. Once I graduated into therapy, the schedule is amazing. Monday through Friday, usually 7:30 to 4 p.m. at the latest. With it, you get your lunch every day. Closed on holidays, never any weekends, so it was wonderful work.
That's really good. What about vacation time, bonuses, insurance, anything like that?
Sure. I didn't get the benefits that most people were because I was considered PRN, even though I basically worked full-time hours. The full-time and part-time above 30 or 32 hours, at least, at St. Bernard's get benefits. So The benefits can be great. Of course, you get your health care, paid vacation. You start off there at 2 weeks, and then that builds 5 years. You get 3 weeks, and then it just keeps building up. Prior to 2011, it was great to work at St. Bernard's because they still had a pension plan. And everyone got the pension, and it was great. And after 20 years of working in the pension, you could retire with full benefits. That stopped in 2011. They moved to a 401k system, which still isn't bad at St. Bernard's. They match, I can't remember what the total is, but I think it's around 6%, something like that. So the benefits are really good in radiation therapy too. The biggest benefit is the hours that you work, because a lot of healthcare, you never know when you're going to work. There's a lot of call. That's never the case in therapy.
Where do you see yourself in 10 years?
In 10 years, I still see myself working at Arkansas State. I don't think I'll still be in this role. My goal has recently changed, where I thought I was going to be a clinician my entire life. The more I get into education, the more I realize I want to help students. So I really see myself trying to grow my career through whatever it may be in advisement or student services, something here at the university, because Arkansas State is my home.
Did you ever foresee yourself working at A-State when you were going through the radiation program?
Never in undergrad, never in the program, just did not anticipate it at all. And when I was given the opportunity to come on as an adjunct and the clinical coordinator, I jumped at it, not knowing if I would like it, but just fell in love with education, but still absolutely loved working in the hospital. And I could go back and work in the hospital now and be completely happy as well.
Is there any work that you personally would have to do to go back into the clinic?
Not right now, because it hasn't been too long, but the more I get out, technology and treatment changes dramatically from year to year. So if I waited a couple of years, I would need to brush back up on my skills as a clinician. But right now I'd be fine. But radiation therapy field advances every day, so I would quickly be outpaced by the students that are in my program.
Well, I think that's all the questions I have. Thank you very, very much for your time.
You're very
I
welcome.
appreciate you doing this.
Anytime. Thank you very much.